Hello, everyone. My name is Marty Guthmiller. I am CEO of Orange City Area Health System, bringing you today on December 21st, the 82nd edition of our COVID-19 community briefings. As it is a Monday, we do have a local scoreboard to present to you today, and it goes like this. We've had 1,640 positives here in Orange City of the 7,958 tested. That is a rate of 20.6%, slightly up from where we were previously a week ago at 20.5. For the week, we've done 156 tests here in Orange City with 39 positives. So that is a 25% positivity rate. I think that's a little misleading though. We're going to give you some numbers that clearly show that things are going down and going in the right direction. The 156 tests this week do represent 41 fewer tests than we did the week before that, and 134 tests from 2 weeks ago, fewer. And so we're clearly doing much less testing, which means there's less disease out there. Now, those people that we are testing are remaining at approximately a similar positivity rate, but there are much fewer of those patients. Much more on what's going on with our local positivity in just a little bit. Stepping back to Sioux County then, we've been focusing on the 14-day average and the 7-day average, as I believe that provides a better snapshot of where we're currently at. The 14-day average for Sioux County is 18.1%. That is up a little bit from 17.3, but down from the 2 times before that at 19.1 and 19.3. The 7-day average, which again is a little closer snapshot, is at 13.2%. That is down from 13.7, which was down from 15.5. So those numbers are definitely going in the right direction. We've also been following the per 100,000 population mark in terms of positivity. And over the last 7 days, Sioux County has been at 320.8. Again, that number by itself doesn't mean a whole lot, but the time before that, we had talked about 386. So 386 versus 320, significantly fewer per 100,000 population. Also, the 320.8 represents a 72% decline in the previous 7 days per the coronavirus.iowa.gov website. So big movement there over the last 7 days in the right direction with a positivity rate going down 72%. We have had 65 more positives in Sioux County since last Thursday. Again, to emphasize the point that we're not quite through this yet. Stepping back then from Sioux County to Region 3, we have 106 hospitalized patients in Region 3, the 20 counties in Northwest Iowa, significantly down from the numbers we talked about before. Previously, we were at 128. Time before that, 138, 150, 174. So clearly 106 is in the right direction, and hopefully we can get into double digits here pretty soon. In addition, in Region 3, we have 15 people in the ICU. That is down from 20. Of those 15, 8 are requiring ventilator support. That is down from 13. So all around good numbers in Region 3, no question about it. Iowa, individual testing positive in the last 14 days. Iowa rate is 13.2, down from 13.7, down from 15.1, down from 15.7. So good trends there. The 7-day average, very similar, 10.4% positivity over the last 7 days, down from 10.5, down from 11.1, down from 11.7. The individual positive per 100,000 population in Iowa is 303.5. That is down from 310.2 when we reported last Thursday. The 303.5 is down slightly over the last 7-day period of time. Iowans hospitalized somewhere with COVID, whether it's in Iowa hospitals or in neighboring state hospitals, is 644, significantly down again from where we were. Our last two numbers were 776 and 863. So 644 is a very good number as well. Sioux County, we have 3 official hospitalizations, 3 residents officially hospitalized. That's down from 9 when we reported last Thursday. Again, I mentioned we are not through this, and we are not. We've had a number of deaths again since Thursday. In fact, we've had 138 additional deaths in Iowa since last Thursday, with the number now being officially 3,589. Sioux County numbers are officially at 41. Again, the demographic has not changed. 93% age 60 and over, and significantly higher when you get into the 80 plus group. So those are our statistics. Hopefully they put a little wind in your sails. They're all actually quite good. And I really have grown quite fond of saying the word down, down from this, down from that, down from this. And so that was very, gave me a little lift today when I saw these numbers. So good stuff. I'm going to shift now to vaccinations and the vaccine. And again, you've been hearing a lot on the national front, but of course, it's the local front that really matters to us at this point. The situation is still pretty fluid, but I have some good news to report that we did receive our allocation of supplies today, which means our vaccine will be arriving tomorrow. Our vaccine for the general public is going to be Moderna, as we've mentioned before, and is required by law to be administered in the way I've discussed before, and it is called the Phase 1A approach, and it's tiering these priority patients, priority recipients, in order that the state believes is best. These are not optional criteria. There are criminal penalties for non-compliance, and so we will be complying with all of those rules, and we are very anxious to be getting those out, beginning as early as tomorrow. Again, we'll be working through the Phase 1A criteria as established by the state, and as I talked about last week, and I'll just read directly from the vaccine shortage order that comes out from IDPH, is healthcare personnel who have the potential for direct or indirect exposure to patients or infectious materials. That's a quick definition. We also have long-term care facility, including assisted living is included in that definition. However, our nursing home population and assisted living population will be 100% addressed by the Walgreens system, which will be using the Pfizer vaccine. It is our understanding, in the last communication that we received, is that the week of December 28, Walgreens will be able to, or will begin administering the vaccine to our nursing home population and to Landsmere Ridge assisted living facilities. As Phase 1A gets rolled out, and it kind of depends, do we get the number of doses that we're expecting? Currently, we're expecting in the upper 200s for the number of doses. Once we get through Phase 1A, we will allocate remaining doses to other Phase 1A providers or recipients in the county and locally. That will all be coordinated through community health partners who will be coordinating all of the healthcare providers who aren't linked with a health system. And so when you think about that, you think about dentists, optometrists, those kinds of things, or those kinds of professions. Those will all be coordinated through community health partners and will be part of the Phase 1A distribution as well. Just a little bit of, I didn't mention our local hospital. Currently, we have no COVID inpatients, no active COVID inpatients. We have some people recovering from COVID, but no active COVID patients. We are also nearing the end of outbreak status at Prairie Ridge. And so I believe our negative pressure walls are coming down today or tomorrow. And so we have weathered that storm and will now be ready for the vaccine, hopefully in another week. As I mentioned, the Moderna vaccine should be here tomorrow. Assuming that it is, we'll begin our vaccination program effective tomorrow. As anything changes on this, I'll be definitely back on. The Orange City Area Health System will be communicating as transparently as we possibly can what happens. We ask you please not to call our desks, our receptionists, relative to what's going on with the vaccine, because we'll get overwhelmed with that. And that'll interfere in other patient care. But we will get information out as soon as we can. It's going to be a little while yet before we're able to distribute vaccines to the general public. But as soon as we are, we'll make sure that we get that information out and communicate to you along the way. Again, really good numbers today. Very pleased to be able to report that. Good news is good to bring you today. So that's it for our 82nd briefing. And at this point, the next briefing is undetermined. We're going to see how the week goes. If there are any changes in our plan, we will bring you another briefing. Otherwise, we'll plan on seeing you again after Christmas. So with that, Merry Christmas. Thank you for all the trust and confidence placed in us and our healthcare team. We will never take that for granted. Thank you, and again, Merry Christmas.